we're going to start our journey of the alimentary canal with the oral cavity. That's where you ingest food, so it makes sense to start things up here. So first things first, the oral cavity itself. The oral cavity is the space inside of your mouth. That's where the food ends up, that's where the drink ends up, the liquids, all going into the oral cavity. Your tongue is meant to move it around. Now your tongue is bigger than you might think. This entire thing is the tongue. So the tongue actually is more than just that top part. The muscle goes much deeper down into your jaw. Then from there, we have the soft and hard palate. Hard palate is bone, it's the roof of your mouth. Soft palate is behind the bone. It's the section right back here. It's not bone, but it is still a barrier between the oral cavity and this part here, which would be your nasal cavity. Then you have the uvula. The uvula is just this little thing that hangs down the back of your throat. So if you ever look inside your mouth, you see that little thing that hangs down there? That's the uvula. Now if you're saying, well, what's the point of the uvula? When you're swallowing anything that's solid or liquid, that uvula gets pushed backwards. So it blocks this passage. It prevents the food and water from going up to your nasal cavity. So the uvula is meant to block anything from going upwards. And you're saying, well, hold on, things can go up there. Yes, sometimes it happens if you're trying to breathe or you're laughing or just coughing or something when you're actually chewing food. But for most normal functionality, you don't want it going up there. It doesn't really feel very good. It's not meant to go up that way. You then have the tonsils. We have the palatine tonsils and we have the lingual tonsils. Now those are part of the whole tonsil ring that goes around your pharynx. That's part of that MALT, mucosal associated lymphatic tissue. We have the epiglottis and the hyoid bone. The epiglottis is this structure right here. Now the purpose of the epiglottis is as food comes down, it's swallowed, that epiglottis is going to fold right down here. The whole purpose is to make sure the food is going down the proper tube, down the esophagus. So your epiglottis folds over and blocks the airway to your lungs. Oropharynx, laryngopharynx, these are regions. This region right here is the oropharynx. This region right here is laryngopharynx. So it's different parts of the pharynx. And then, as I mentioned before, are the esophagus and trachea. Esophagus is where you want the food to go. The trachea is where all the air is. That's where you're breathing. And that's why you have the epiglottis that will go down and cover this, blocking your food from going down there, blocking your water from going down there. Now, if you're saying, well, hold on, it can get down there. Yes, it can. Because sometimes if you're trying to breathe while swallowing, you're laughing, or all of a sudden you cough, the air comes out, opening the epiglottis, allowing that food that was here to basically go into the wrong tube. So if you ever have that, oh, I swallowed the wrong tube, that's usually what's going on. Something got into here and irritated that lining. It's not meant to have any food or liquid in there. So a little about the oral cavity and the mechanisms inside of the structural unit that is your head, basically. Muscles. Hopefully this rings a bell from AP1, orbicularis oris, and the buccinator, helping to control your lips and your cheeks. The vestibule. Vestibule is just an entryway. It's the space between your lips and your teeth. Now there's not a lot in there, but that little space is the vestibule. If you're thinking maybe you've heard that term vestibule before, the vestibule is known as an entryway into a building. This case is our entryway into our mouth. The vestibule, lips to teeth. The oral cavity itself is from the teeth inwards. So once you pass the vestibule, you then end up in the oral cavity. We have the labial frenulum. Now these labial frenulum are what attach the upper and lower lips to the gum. So if you kind of look, and I'll show a picture in a second, but that's that little tiny attachment point just behind your lip, that little line that helps anchor things down in place. So you're looking at, you have your upper and lower lip, but then here's the vestibule, the space between the lip and the teeth is the vestibule. Then we have the superior labial frenulum. That's this line right here. It's helping to anchor the lip back to the gum. Inferior labial frenulum is right here, anchoring the lower lip to the back gum. We then have the hard and soft palates are up top. You have the uvula. This is the uvula. Make sure we're on the same page there. Come on. And then we have the tongue itself. Now, on the tongue, there are different papillae or little bumps. Now, of these papillae, some contain taste buds. The first papilla is going to be this fungiform papilla. Now, the fungiform papilla is scattered all over your tongue. What you're seeing is each one of these little bumps, that's going to be a fungiform papilla. So they're scattered all over the visible part of your tongue. We have the circumvallate papilla. Now, the circumvallate are forming more of a V shape towards the back of your mouth. This is a circumvallate. Now, normally you really can't see those unless you can really stick your tongue out very far. So that more needs something kind of look in and see down a little bit. But that's the circumvallate papilla. We then have the folate papilla. The folate papilla are on the more lateral aspects of the tongue here. Now, they actually look like little slits on the lateral sides. But all three of these papilla are containing taste buds. So the 5 different tastes that you have, all those taste buds are inside all of these 3 different papilla. So here are the folates on the sides. Almost like little slits in the side of your tongue. Those are going to be the folate papilla. And to round it off, the 4th of the papilla are going to be the filiform papilla. Now, the filiform papilla, they're all over your tongue, giving kind of a roughish texture to your tongue. So if you notice, they're here, but there's really nothing visible on the drawing right there. Because they're a little bit smaller, and they're just kind of giving the entire tongue that rough texture. That is the filiform papilla. Now, on the tongue itself, obviously you can see a bit of your tongue, but this whole area back here, you really can't see. That's referred to as the root of your tongue. The root is the part that goes down in the throat a little bit, down in the pharynx that you really can't see visibly from the outside of your mouth. The visible part is the body of the tongue. So back to those taste buds I mentioned a second ago. There are 5 types of taste buds. First up is the sweet. Now, sweet usually tells you you're rich in energy, rich in nutrients here. So it's a way of getting a lot of energy in quickly. Think about if you're eating anything that's very sugary. You're having more sweets, more carbohydrates going in. That sugar going in, that's energy, a very fast form of energy. Umami. You're saying, what the heck is that one? Umami is a taste of amino acids. For this one, it's more a cheese, more beef broth. You're getting what the pure amino acid taste is like. Salty. I'm pretty sure you can probably guess what that one's referring to. Having a taste of salt. So you're looking at it helping to balance your electrolytes. Because salt, sodium chloride, is one of the main electrolytes in your body, helping to balance off your water intake. So salty, sometimes you're craving something salty, could be because you have an imbalance in electrolytes. I'm saying could be because it's not always the reason. Some people just crave salty for themselves. But sometimes that needing for something salty could be helping out your body balance itself out. Sour. Now this one's more the taste of acids in the food. So if you think about things that are sour, a lot of times have more of an acidic aspect to it. And bitter. Now bitter, you usually don't want something that's bitter because bitter is usually more associated with different types of toxins. If something's bitter and you're not expecting it to be bitter, usually you're realizing something's not right, that might be bad. So something you should not be eating. It's a kind of a natural defense your body has built in. So the 5 different types of taste buds housed within those 3 different types of papillae. But that's not all. We talked about salivary glands also. Because your entire oral cavity, as you ingest food and start chewing, saliva is coming out. Now the saliva is both coming from extrinsic and intrinsic salivary glands. The extrinsic glands are things like your parotid salivary gland, your submandibular salivary gland, your sublingual salivary gland. These are the three large main salivary glands. But the intrinsic, they're right inside the mucosal tunic. Much smaller, but they still play a role in producing saliva. So what does saliva do? Well, first off, it helps clean the mouth out. There are going to be different antimicrobial proteins and different components that are breaking down foreign particles in your saliva. You have the moistening and dissolving of food. Now that one's very important. Think about if you ever tried to chew up crackers over and over and your mouth gets dry and you don't drink anything. How easy is it to chew your food when you don't have enough saliva? It gets kind of pasty and chewy and it's hard to swallow. So this idea of moistening the food is very important to allow for the ease of swallowing and the movement throughout your system. You have this idea of term bolus. Bolus is going to be that mixture of the food you ingested plus all of the saliva, the enzymes, the mucus, everything mixed together. So the bolus is that kind of mixture of what you added into it from your saliva and everything else and the food you ate. And we also have mentioned before enzymes. In the case of your saliva, there are enzymes that help to start the breakdown of starch. And that'll continue on down your stomach as well. But you do have some enzymes that are helping to break down the actual food product to start with. So looking here, we have the parotid salivary gland. We then have the submandibular, right under the mandible here. You can see the mandible is cut. And then we have the sublingual. Lingual being tongue. So it's found just underneath the tongue. The three main extrinsic salivary glands. Now if you notice the openings, you have the submandibular has the opening just underneath the tongue. The sublingual ducts come off just the side here. So there are ways that bring that saliva right into the mouth from these extrinsic glands. So what is saliva? Well, the majority of it's water. Up here, 97 and 99.5% water. Because the main thing is your saliva is meant to add moisture to the food, making sure it can be pliable, and when you swallow it, that can be conforming to the tube on the way down. So you have that, plus a mixture of mucus, of course. In there, though, we have electrolytes, salivary amylase. There's that enzyme I was talking about. That salivary amylase starts to break down starch right away. You're going to have this lingual lipase. Now, lingual lipase is more for lipids. You're not really starting much breakdown at the point here in the mouth. The breakdown starts initially a little bit further on down. You're going to have mucin. Mucin is the mucus. It's meant to give kind of that coating to the food, helping create the bolus. Metabolic waste, things like urea, uric acid are found here. You have lysosomes, IgA, defensins. Even a cyanide component is found here. The idea is these are all helping to try and create a defensive system in your body, helping to make sure any bacteria, things that are coming in that shouldn't be there, are being destroyed as early and as quickly as possible. So there's a lot of stuff going on just in the mouth itself, just the initial stage of ingestion.